it is now time to move on to the fitness segment. And this is for all our members and their clientele, where lower back pain specifically poses a very big problem. And of course, we have brought Dr. Aarti Prasad yet again for all of you, Mrs. Aarti Prasad yet again for all of you. And I think we have often introduced her, but I must say that, you know, she is an achiever in the field of physiotherapy, and also that she gives very, very very wonderful messages for physical fitness, with protecting the joints and protecting the back. How can you achieve your goals in physical fitness while conserving the joints and cartilages and not injuring in the process? Lower back pain is a real plague, and often we are at the wit's end as to the medication, but then exercises do help to some extent. And to tell us about the do's and don'ts is Aarti Prasad. Aarti, all for you.
Good morning, everyone. And good morning, Shobha, for that introduction. And hi, Dr. Nirja, how are you? Nice to see you again. And as usual, you're so trim early in the morning. It feels very nice to see that. And I'm in my exercise clothes. So I'm very upset with Shobha because every time I'm with my exercise clothes only. So, and it's a
that's why we love you so much, because you bring in the true spirit of fitness into our program.
No, it's like fighting a battle with the obstetricians and gynecologists who are always extremely well dressed. Let me say that to you. They are all well dressed. I have to congratulate you on that. Now, the sad part is, like today, we've had such a lovely talk from Dr. Ivita. I heard the last part. It was beautiful. And here I am, bang, we are coming back to something which is practical and more so that our legs are rooted to the floor more importantly. So now let me just, about 2-3 minutes of introduction about back pain. The causes of back pain can be various. And talking on the menopause front, one of the most important causes for back pain is osteoporosis. And women have to become aware of how to take care of it. It is very important. Now, backache can be because of just as simple as the iliolumbar ligament, which comes here. It can be because of the strain on the sacroiliac joint. It can be because of spondylolisthesis. It can be because of lysis. It can be because of spondylosis, which is degenerative changes that can occur. That generally occurs in the spine. Now, I just want to talk about something which is very common, that is idiopathic backache. It can be because of postural changes. It depends on how we carry ourselves, how we take care of our backs more importantly. So the most important is, I do not want people to slouch. Now, what is slouching? Remember, if you have a spine which you are like this, you've got rounded shoulders, you're going to affect your shoulders. At the same time, your abdominal muscles are not working at all. Your back muscles are getting overstretched. So a tendency to be like this will cause back pain. Now, the back pain can be lower back pain or it can be upper back pain. So what I want all of you all to start doing is sitting straight. How do we sit straight? You just have to lengthen your spine. Just lengthen your spine and keep your shoulders braced. Don't overdo it, but just a small brace, and try to tuck in your stomach very minimally. Just a small tuck. Don't breathe in and take it in, but just a small tuck. Remember, throughout the day, if you can hold this small tuck of your stomach, it is going to straighten out your spine completely. My advice to all the obstetricians and the gynecologists who are out there, if you have finished one case of delivering a baby, whether C-section or vaginal, remember, just go down on the bed that is available, do some simple exercises that I'm going to show now, and that will really take the strain off your back. More important. Now remember, the back is supported by various muscles. Now I get a lot of referrals saying that core strengthening. So what do you mean by core strengthening? What does the core consist of? The core consists of the abdominal muscles. It consists of the back muscles. It consists of the hip muscles. That is the abductors, adductors, flexors, and extensors. So this whole system is the back. So abdominal muscles consist of, the flexors and the obliques. So what I will go down on the floor now. I'll show you some simple exercises which you can just do for 5 minutes after you finish your work, and you're going to be free of back pain. Okay? So I'm just going down on the floor now. Everybody can see me clearly? Yes? Okay, great. So now remember, I already talked to you about a tuck. Okay, so before I go again, just let me show you one more exercise, which is called as the pelvic tilts. The pelvic tilts. So what I want you all to do is, I just want you to push your bum out and then tuck your stomach in. So you're moving your pelvis through the whole range that it is supposed to do. These are pelvic tilts. This is like belly dancing, but it is extremely good for your spine. So you move up, you move front, and you move behind. Front and behind. Front and behind. And then take it to the side, side. So you're moving your obliques, you're moving your quadratus lumborum, and just give a small circle in both the directions. That is really going to be part of your important exercise in standing. This you can do anytime, anywhere, in between your consultations. Please go ahead and do. It is an excellent exercise. So I'll just show you some simple exercises on the floor now. So we lie down. We lie down and tuck your stomach slightly. Take your leg up to 90 degrees. Other leg up to 90 degrees. My neck should be down. Remember, the neck should be down. Hold this exercise for some time. Hold this exercise for some time and gently bring one leg down, other leg down, and then release. Again, tuck the stomach in, hold the leg up, other leg up, hold it there, hold it there. Now slowly bring it down, and then release. This is going to improve the stability of your lumbar spine. Remember, it's an excellent exercise to improve the stability of your lumbar spine, and it's a core contraction of your abdominal muscles. Okay, now the same exercise, I'm going to I'm going to challenge it a little more. So we go like this, hold it up there, and with the opposite hand, push the knee. Now the opposite other side. Push. Now again the opposite side. Push. Push. These are very good oblique exercises for you. Plus a good contraction, isometric contraction of your abdominal muscles. Just show you one more of the abdominal muscle exercise. You can just, if you want, you can lie down like this and stretch, 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 and you can do it for about 20 times. Slowly increase to 25 so that you keep challenging your muscles more than anything. Now you want to challenge the muscle even further, you can add some weights onto your legs. That's going to challenge the muscle even further. Okay. Now in this position, the most common exercise that people do is this. Tuck your stomach in and lift your pelvis up. And you can do this. And you can challenge this exercise by lifting the pelvic leg up and bringing it down. And take it up and bring it down. Now I want to challenge this exercise a little more. I use the ball. So I take it, I keep it there, I keep my legs, and we lift our pelvis up. And up and down. Then we take one leg off, hold it there, down, up, down, up, down, up, and down. Remember, when I'm doing exercises on an unstable surface, I'm going to improve my proprioception. Now, proprioception is something which is very important as we go down the age because it improves your proprioceptive cells inside your joint, which help you to balance yourself more importantly. Now, balance is something that I always talk about. Balance is something that gets lost, goes slowly, deteriorates as we age. So we don't want that happening. So we can do this, use the ball as a proprioceptive tool to improve proprioception. So I would really suggest a ball a lot, and that would really be helpful. Now, you want to improve your abdominal muscles a little more. You take this up, 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 up. So you start with few counts and then slowly increase it. This is another important exercise. As I said, the pelvic tilts can be done as soon as you finish your theater, and then you will feel much better. I'll show you some simple exercises on the prone position now. So you just lie down and take the leg up. So your hip is going into extension. Other leg up, up, up. And then both the legs up you can do with your hands up. So you do a complete extension of the spine. Always remember, when you do flexion exercises, you should immediately compensate it with extension. Unless you have spondylolisthesis. If you have spondylolisthesis, you cannot do extension exercises. And if you have a stenosis of the spine, you cannot do flexion exercises. So you have to really understand what is wrong with you, with your spine, and then take it up more importantly. The other important exercise I really wanted to show today was osteoporotic stretch. This, what happens with osteoporosis is we tend to go into a kyphotic position because the vertebral bodies, fractures occur on the vertebral bodies and you can just collapse. So what we try to do now is we try to see that you do a good stretch of both the upper limbs and the lower limbs together. So I'll just show you that stretch, and you can do this every day so that you never get into this dowager's hunch or the hump, that is dowager's hump, that is called. In the olden days, you used to see a lot of women bending down slowly like this. Let's avoid that by this very simple stretch. If you can do it 4 to 5 times a day. The first one is keep one leg bent, the other leg stretched, and the opposite hand stretched. So you're doing a diagonal stretch like this. Stretch it, hold it for 5 counts, take a deep breath, and release. Take a deep breath, and release. Now, we are going to bend the other leg. Stretch the left leg now. The right hand goes up. Stretch it out from the shoulder. Give a good traction to your spine and feel that oblique stretch that is happening. Let it stretch completely. Stretch. And down. Now we stretch both the hands and the legs together. See that you're breathing well. And stretch it. Hold the breath. Hold the breath. And release. This is an extremely important stretch for osteoporotic spines. So these are some of the exercises which can be easily practiced anywhere, anytime. You don't have to think about how much food I have in my stomach. You can just do it, and that is really going to be helpful to your spine. Remember, the ultimate mantra is tucking your stomach in slightly, very minimally. Keep it so that the exaggerated lordosis because of weak abdominals comes down. So this is something that I wanted to talk about. So this way you can really take care of your back. Any questions?
Yeah, Arti, that was really excellent. You're always too good. Now, the beauty of these particular segments of our Prerna program is that we have something motivational, and then we go diametrically opposite, like you said, and do exercises for the physical body. It's not just physical. This is going to impact our mental state also. So while we wait for audience questions, let me start from backwards with a few queries. So one of these queries was that when you're doing this osteoporosis stretch, so in that stretched position, how is the breath? Can you tell us again? The breath.
When you are stretching out, just breathe normally. Continue to breathe normally. And when you finish the stretch completely, when you're holding the stretch, hold a few seconds. Hold the breath for a few seconds and then release it. Yeah. Now, since you were talking about from mental health, we switch to physical. I just want to add on something. Remember, a muscle needs to be thought about in the mind. It is very important to picturize the muscle. If you want to strengthen the muscle, you have to think about it in the mind. That means you're thinking about the abdominal muscles and then working on it. It is definitely going to improve faster. So again, mind plays a big role even in this. Yeah. I tell all my patients, concentrate. Forget about everything else. Concentrate on the muscle and you'll do a wonderful job.
I have no hesitation in saying that I keep a pen and I write down every word that you say.
I could see that. So I was concentrating much more about what I'm speaking.
Yeah. So one query. There was one thing you talked about where you're on your back, and with opposite hand you've lifted one leg up, and with the opposite hand you push the knee. My query is, should we push the knee, because many people will actually put pressure on the knee, or should we go a little above the knee on the thigh?
When I just put one leg, bent the leg. This is the exercise you mean?
Yes. Yes. Then you're putting one hand on the knee and pushing it. That exercise. That was the first one, where you're lying down and you raise your leg at 90 degrees and then push the knee. So do we actually push the knee?
I'm not straining the knee at all. I'm straining my pelvis.
Okay.
I am challenging my pelvis extensors. In order to challenge it a little further, I would say contract your gluteal muscles. So
Okay.
you're doing a lot of pelvic floor also simultaneously.
So when you say contract your gluteal muscles, because we have a lot of non-medico audience, so that means tightening the anal sphincter.
No, tighten your butt.
Tightening the butt.
Yes, that is the instruction I give to my patients. Just tighten your butt, because quite a few of them won't know what is glutes. So I just tell them tighten your butt.
Is it so easy? Because tightening the sphincter, it is easier to tell them, in descriptions that it is like all of
Yes.
the.
They do not understand. Basically, the adductors contract. The adductors contract. The gluteal muscles contract. So I'm not as automatically there is a contraction of the pelvic floor. This is just an add-on, but the concentration is more on the back extensors.
Okay.
Back extensors.
Yeah. Then one query. Now, what is there any contraindication? I will use it in layman language. Are there any conditions in which you should not do the pelvic tilt? Can you show us the pelvic tilt again? Because I have written it down, but people may not.
And that is a pelvic tilt. Now, what is exactly a pelvic tilt? It is extension of your lumbar spine. I would say more of the lumbosacral spine. That is what is a pelvic tilt. Now, in spondylolisthesis, you do not do a pelvic tilt.
Spondylolisthesis means when one vertebra has shifted from its position either in front or behind.
Because of the break in the pars interarticularis or break in the attachment of the pars interarticularis. So it moves forward or behind. So we do not do extension because that exaggerates the listhesis. So we don't do. We teach them all flexion exercises.
I see. And listhesis is usually associated with a lumbar canal stenosis. So
it can because if it's a retrolisthesis, it is going to compress on the canal. So but it depends on the degree of listhesis. 1 to 5, you have degrees. So it depends on that also.
So it would be wise for patients who have low backache and have been diagnosed, say, with a hypertrophy of their vertebra, or there's a lumbar canal stenosis, or there is a listhesis or a shift of the vertebra anteriorly or posteriorly, to check with their ortho doctor which flexion or extension they should not do. So
So that is when they really have to get a good MRI. The investigation procedure should be done properly.
Assessment evaluation should be good.
Is very important. You assess them and then you decide whether you want to give only isometric contractions or you want movement also included treatment.
can you
Ortho
tell us
and
once
physio-
again which isometric? Which?
Isometric is just pulling your stomach in,
Yes.
tightening your butt. All
Yeah.
those are isometric contractions which are without a movement.
Okay.
Any exercise which is just contracting, like you're pulling your stomach in, that is an isometric contraction. But this is not an isometric contraction
Yes.
because you're causing a movement.
Yeah.
So no movement is an isometric contraction.
Shobha, you were saying something?
I was only saying that that consult thing which we were getting across of evaluation, in that I think ortho consult as well as the physiotherapy consult, both will have to be, and there
Yeah.
has to be a lot of harmony between these two consults, and then the
Yes.
final thing will emerge. The final management plan will emerge.
You have to work as a unit, more
Yes,
important.
yes.
Because
And
once
also
the
the
orthopedician
patient is at the
tells,
center. Yeah.
yeah, he tells or he or she tells us what exactly is wrong, then
Yes.
the physiotherapist can design the program for you.
Yes. Yes.
And whatever exercises we talk about in our programs, there is a disclaimer that it is not for all. You would check out your own medical condition and then you do. And I'm going to repeat for the benefit of the audience one very important thing that Arti said. And Dr. Aarti Prasad, she said that sit straight, don't slouch. And for that, she said, visualize lengthening your spine and brace your shoulders a little bit and tuck in your tummy. So
Very
this,
minimal. Tucking in is very minimal, remember.
yes, I think this will help us in improving our posture and while sitting and standing, and to do it all the time, whether you're talking to somebody or something. I think this was a beautiful takeaway that you have given us, in addition to your beautiful pelvic tilts and exercises for osteoporosis, spine. That was amazing.